My name is Dorothy Ratusny, and I'm a psychotherapist in private practice in Toronto. I've been practicing for probably about 12 years or so, and I work with adults, couples, adolescents, teens. I've also done some family work, but primarily it's adults and couples I see most often. You know, there's clients that have pulled a gun on their spouse because they wanted their spouse to admit something. There are clients that smuggle drugs. There are clients that are really abusive to their children and to their spouse. My training has been primarily in cognitive therapy, which is the most widely practiced and researched model of psychotherapy in the world. And I bring in other elements of psychotherapy. So I'll bring in, for example, a mind-body, like a holistic approach. So if somebody's looking to explore an element of their spirituality, or if they're looking to learn some new skills or tools, primarily when people come in, they've been struggling for a while on their own with a certain problem or issue or situation, and they're not getting anywhere, or they're not getting the results that they want fast enough. So what I do best is help them figure out what's going on, what they need to do to change. It means looking at themselves in a really honest and self-reflective way, because when you start to do that, when you look at yourself real and honestly, you peel back the layers of what you've put there to sort of show the world and show other people, and you get to what's really true. And then when you start looking at what's true, you realize, you can't help but realize what you need to do to change. And so I'm just facilitating that process. And whether it's helping them figure out how to manage their emotions better, or navigate through a relationship or a situation of loss or grief, or figure out what they really want to do with their lives. I mean, it comes down to the same core elements. And what's great about the way I practice is I'm giving clients real tools and strategies. So they leave having some skills that they can then apply to not just the issue that they came in for, but in any aspect of their lives. So they're not dependent on me forever either. Absolutely.
Absolutely.
Hello. Absolutely, I give homework. Not just because research says that clients will move quicker through therapy, more successfully, if they're doing work outside of that 50-minute session. But homework means you take the ideas, the aha moments generated in therapy, the examples, the suggestions, and you can apply them to your life. So you can start practicing the things that you've been working on in therapy. You come back, maybe sharing what's working well, what didn't work so well. You get a chance to practice being different right away. So it's not just theory-based. It can't just be theory-based. I do this work because it gives me a great deal of inner satisfaction and fulfillment to see people change and evolve and grow and transform themselves. And as I got going in it, I realized how much I enjoyed working with people and helping them figure out things in their life to make their lives better and make themselves better as well. I love the fact that cameras can capture what really happens. And I know from experience that when clients start to get used to the idea that there's a camera in the room, they start to forget that it's there, because what's more important to them is fixing them or fixing the problem. So they can put that first on the agenda, and the cameras kind of get forgotten about. And then the real good stuff happens. What I loved about this project was that it's giving the viewers a really honest, I feel, an honest look at what happens behind the closed doors of a therapy session, which people unfortunately still have this idea what they think happens. And yet therapy, as I'm sure you all know, is for high functioning people that are just needing a little bit extra help going through something in their life. What happens when you have the right mix, let's say the right therapist and the right process, or the clients that are so motivated to do this work, it's amazing. It's life transforming. And I have clients who say, you know, thank goodness I met you, or thank you for all that you've taught me or shown me. My life has changed. I still get notes and cards, and it's not just the rewarding part of that, it's knowing that their life is forever different because of what work they accomplish. So if this show could could speak to that, could show that, that would be amazing. In some way, maybe it looks like you're a bit of a crybaby, fine, so be it. But what you do is you validate somebody. So if you're telling me a story that's really, really sad, and if I show you a little bit of emotion because it's real, not because I'm trying to just to fake it, if I'm really feeling for you, that's going to validate your experience. That's going to allow it to be more real, and it's going to allow you to feel heard. And that's important because part of therapy is exploring yourself, but it's also about being heard and validated. So I've learned that, yeah, I can emote, I can, show my emotions at times, but it's actually important. And so that's why there's 2 boxes of Kleenex. Sometimes I use them too, yeah.